So it's normal, first of all. It's very normal to feel a lot of anxiety. You see, when clients are getting ready to come in, like we've assessed them, they've made the decision they want to come, it's the best place for them, all of that, um, and we've booked them in, they'll fluctuate between excitement and anxiety, right? And it can be a dangerous time for drug use because, or alcohol, because, that when your anxiety spikes, when you're in active addiction, it can trigger, more substances. So what we do is, one, we stay in touch with them, right? We talk to them, daily or every few days, depending on when they're coming, and just be there for them, and just remind them that change is around the corner, that they're almost there, they're almost here, and their life's about to get a lot better, right? A lot of the fear and anxiety is, what's it going to be like? The day-to-day, certainly, which I'll go through. What are the other clients like? You know, what's going to happen when I'm there, right? And then also, will it work? That's the other thing, because they're taking a big step. They've made arguably one of the top three biggest decisions they'll ever make in their life is where they go to treatment, right? Maybe the biggest. So will it work is a big one. But as far as the day-to-day goes, and talking to them and easing their concern, we and a lot of this stuff we do on the front end when we're talking to them during the initial conversations. This is how it goes, so they understand. We make sure we're the best fit for you. We make sure there's, available space. And then we, assuming they're coming to us, right? Let's say we do a VIP pickup at the airport. So they have someone with a sign with their name on it, meet them at the airplane, right off the airplane, and take them through the VIP diplomatic lane of immigration. So it's very quick. They're not waiting in long immigration lines. They have an assistant there, guiding them through. And then on the other side is actually the managing director and founder, Mark Heather, who will be there waiting. And he loves to pick up the clients because he's just great with them, and they love him. So he gets them. It's a handoff. And then we are about 15 minutes from the airport. You arrive, we get you comfortable, checked in, settled, into a good place, right? Get you some electrolytes, have the nurse check on you, make sure you're getting comfortable. And that's the biggest thing. You're not going to just get there and jump into the program, right? Like the first thing is just getting you settled and comfortable and making sure you're good with your surroundings and you feel, at peace with the place. And then over the next few days, we ease you into it. But we're very gentle. And so, and that's almost everybody that comes in. It's a gentle process because it's delicate. You have high anxiety, you probably have drugs or alcohol in your system, even from a couple days ago, and you all over the place. So it's just it's about love and service when they get in, and that's what it is. And making sure that they're, that's the first step of it. People get anxious about, like, how is it gonna be like? Are there gonna be like doctors with like prodding their eyes to like examining them and stuff? Like that's So I try and paint a picture of what it's actually like. They're gonna get on a plane, maybe two planes. It's gonna go by quickly. And then they're going to be at the airport. Once they land in Phuket, then it's very easy from there. So yeah, then the day-to-day, as they ease into the day-to-day, it's going to be a mix of individual therapy and counseling and group classes, mixed with fitness, mindfulness, meditation, meetings, things like that. And then they'll have some hours of downtime in the afternoon, a couple hours in the morning. But a typical day, you have the options to do yoga or a beach run, beach walk, ocean swim in the morning. We do breakfast, check-in. We might go to a big sports and wellness complex called Tanya Paro. It has everything, tennis courts and Olympic swim pool and hot and cold therapy, weights, everything. So we might go there, or we might go into some group classes, which will be like, and I usually go through a weekly schedule with people too to show them so they can see, they can visualize it. I'll send it to them and then go through it with them. But we might do psychoeducation, which teaches us about cognitive distortions, black and white thinking, catastrophizing. A lot of people in addiction catastrophize. The worst thing's going to happen, right? The sky's going to come falling down. Well, that's not reality, right? So we need to learn to think, so we're not freaking ourselves out in different types of ways. So that might be psychoeducation. And then relapse prevention. Relapse doesn't happen just out of the blue, right? It's not just one day we're like, oh, we're going to go drink or use, right? It happens weeks or sometimes months prior. And so relapse prevention teaches us how to recognize those warning signs, right? It's like looking at a car dashboard and seeing, okay, this one's blinking, what do I need to do? And the whole idea, and when I talk about removing the whole desire to escape, to use or drink, is that you deal with stuff upstream. So you see that blinking light and you deal with it, right? And it could be, it could be as simple as I'm hungry, or I'm hungry and I'm tired, right? Well, you need to rest and eat, which is a basic one, but there are other ones too. So you need to learn to read yourself a little bit more and be in touch with yourself. So that's relapse prevention. We might go into mindfulness, which is about slowing things down and recognizing and being in touch with what's actually happening around us, breath work and things like that. Process groups, which are run by therapists. Most of our classes are run by therapists, but the process groups are, a special type of group therapy that no one's allowed in except for the clients and the therapist. And the reason is because it's a safe space where people can share what's going on with them. They learn to share in a group. They also learn to listen to people and understand where someone else is coming from and have compassion. And then we eat lunch. In the afternoon, there's usually one-on-one, so you'll meet with your individual therapist or your individual support counselor, which are two different people. The support counselor just helps you guide through the program, make sure you're happy, make sure your needs are being met. You might need a special type of charge or a special type of dietary requirement that you need to have picked up, things like that. And the therapist is there to help you work on your underlying issues and deal with that's like the real stuff, and make sure you're on track and put together a treatment plan for you and all of that. Usually have a few hours in the afternoon to rest and spend time with people, and then we eat dinner, and then we have a meeting, and then it's the time's yours after 8 p.m. So that's a typical day. On the weekends, it's a little bit more lax. We go on an excursion on Sundays. We might go out to the islands or spend time with the elephants, or something fun to get out of our heads a little bit and have some fun. Saturday we go to the beach. So those are the typical day-to-days. But I think someone for coming in with high anxiety, it's about a lot of keeping in touch with them and making sure and addressing their concerns and making sure, that they're asking everything, because sometimes people are even scared to ask questions, right? So like you spend time with them and, just reassuring. The only thing we can do when we're dealing with something like addiction is the next right thing, right? And for the most people who are going into treatment, going into a rehab, that is the next right thing. And they should be proud. They should be gentle with themselves and be excited and pat themselves on the back, because that's the right thing for them, for their families, for everybody, right, around them. So for most of us who went to a treatment center, it's like a 180 in our life. And we need to, that 180, there's a lot of anxiety of what to expect. But at the end of the day, we can have a little peace of mind until we get there knowing we're doing the right thing. So that's what I try and reassure them of, and just reassure them that you're gonna love it, and get to a good place and get this monkey off your back, and you're gonna get some peace of mind back, and that's what it's all about. So Don't worry, we're not going to rush you in. We're not going to shove, books down your throat or anything weird like that. We're going to gently guide you into the program and make sure you're comfortable and getting your step back.